Lynn Grodzki, welcome to Shrink Wrap Radio.
Thank you. Good to be here.
Well, it's good to have you here. I'm really so glad to have you on the show. And I'm impressed by your publishing history. I see that your book about how to grow your private practice has, in your bio, you note that there have been tens of thousands of therapists who've bought that book. So
Yeah.
congratulations.
Thank you. Thank you. Yeah, that was a very popular book, and it's been out for almost 20 years, although we did a revision in 2015, so it got very updated. But it's really sold well internationally for my publisher.
Yeah, well, that's wonderful. Well, today we're going to be talking about your book and I forgot the full title, but it's Getting a Coaching Edge into Psychotherapy. What's the title? I don't have it in front of me.
Sure. It's Therapy with a Coaching Edge, Partnership, Action, and Possibility in Every Session.
Wow. I can see why your books sell well, because they promise to deliver a lot and the kind of information that people really want to have in order to thrive in their businesses, in their therapeutic and coaching businesses. I blush to confess that I think for a time I had a sort of prejudice about coaching, that the people who became coaches didn't want to, they wanted to be helpful, they wanted to be therapists, but they didn't want to have to go to school that long or have to take the licensing exams. Now, at this point, I think I'm a little wiser than that, but do you think that's a perception that other people have held out there, maybe still hold?
I think it's a very fair perception.
Uh-huh.
We know what it takes to be a therapist, and most therapists have a master's degree or more than that, and they are licensed by their state. And you can be a coach with no training whatsoever. So it's a buyer beware market for coaches. You can just call yourself a coach, and there is no need to have gone through any training or any certification. I certainly wish that people would get more training and get certified, but there's no requirement for that.
Yeah, well, I'm glad to have you lay that on the table, given that you've got a foot in both camps, and I think you're very true to both camps.
Yes.
So that's good to hear.
So let me just say that unlike a lot of other people, I actually have gone through all the hoops, jumped through all the hoops for coaching. So I'm a what they call a master certified coach, and what that means is I've gone through the highest level of coach certification, and I also teach coaching at an accredited coaching school. And so I just see the complete realm of coaching, from the people that are not trained to those that are very highly trained. And because I'm a therapist and believe in therapy, and I also, at this point, very much appreciate a lot about the coaching world, that's kind of what positioned me to be able to write this book.
Yeah, and now, of course, certified coaching schools, there are a bunch of them out there, right? And my impression is that they would vary in terms of length of training required and rigor and so on. I would think they'd be along a continuum. How does a person find a good one?
Well, there is one certifying body right now called the International Coach Federation, and they are working hard to get schools accredited. And to their credit, I think they're trying very hard to create a common understanding and a common ground of what coaching is and what it's not. And these days, it's actually not easy to be certified as a coach.
Oh.
Many of the coaching schools have had to do a lot to get through accreditation. They've had to agree with what the core competencies are and how they teach their students. So I would suggest that people look for one of the schools that's accredited by this body, by the International Coach Federation. And then once you go through one of those schools, to get onto a certification track. And it's not important for all coaches, but for some coaches, depending on where they want to be working, it's important.
Yeah, and I forgot what my thought was here. Oh, it was about state licensing. Currently, the states don't have licenses for,
No.
and does anybody want to see that happen?
Well, I think we're a long ways from that. You know, you have to realize that as a therapist, most therapy schools are universities, right, or
Yeah,
colleges. Most coaching schools are privately held institutions.
yeah,
So there's a big difference between what could be licensed as a therapist and what might be licensed as a coach. So they're a long ways away from that. So right
yeah,
now, certification is what's on the table.
yeah. Also, but there are lots of freestanding psychology schools as well. And, you know, some of them struggle to get their nose under the tents for
Yeah,
their people to be
yeah,
licensed.
that's
And
really true. That's
yeah,
really,
and a number have met those standards, and others probably have either given up or in the process of trying to
yes.
get there. Yeah. Um,
So what I
so
thought was
yeah.
interesting for myself is, you know, after being a therapist for 30 years and a coach for 20, I realized at a certain point that the coaching profession was really creating what I would call something that was unique and specific to coaching. That
Hmm.
I could finally say it seemed different than consulting, it seemed different from therapy, it seemed like the coaching profession had really developed kind of a body of methodology. And as I started to look into that methodology more and more, I realized that I was bringing some of that into my therapy work. At first, it was unconsciously. And then
Yeah.
I looked to see if anything had been written about this, about
Yeah.
bringing coaching skills into
Right.
therapy. There hadn't been anything written about it. So I started to review the literature and wanted to write this book so that if therapists wanted to bring specific coaching skills into therapy, they would know how and why and what to do, and most importantly, what not to do, because coaching is not therapy. These are,
Yeah.
I see these as really different professions.
Yeah. Well, I really hear what you're saying about that hole that was existing in the literature, because I've done some other interviews on this topic, and it's been kind of a gray area in some ways. And I thought, wow, I just saw the title of the book, and I said, boy, I've got to interview this person. I want to take a look at that book, and I want to interview this person because I think this is something that's really needed to bring some clarification. I've got my own questions, and, so I'm really glad that you did that and to have this opportunity. So if I'm understanding you, you were a therapist for 10 years before you.
Yes.
And so let me ask you two things. One is, what drew you to wanting to become a therapist? And then I'll ask you what drew you to wanting to be a coach.
Well, I became a therapist probably in the way that a lot of people became therapists, which is I went into my own psychotherapy
Uh-huh. Okay,
and
good.
was really at a time when I really needed therapy, and I was really fascinated by the process of therapy.
Mhm.
And uh, I kind of dabbled in a little bit of therapy, even though I wasn't working as a therapist. I had another job. And at one point, my therapist said to me, it seems like you might want to become a therapist. You seem really fascinated. And so I did. I went back to school and got an MSW and really studied hard to be a psychotherapist. And I've been a psychotherapist for 30 years now in private
Yeah.
practice and continue
And
in
did
private
you
practice.
already have a different career at
I
that point, just
I
before
did.
you?
I was working in the family business as a general manager in the family business.
Oh,
And the family
family.
business was scrap metal. So I was the general manager of a scrap metal yard.
Yeah,
A
that's a pretty big leap in a way.
pretty
But
big leap.
another way that I understand it, though, is the coaching part of your life, and even all of it, actually, there's a kind of practicality to it. Your
Yes,
books are all about, here are the nuts and bolts, if you will, from the scrap yard to how you run a business or how you do this practice. So,
yes.
so
So
I
what,
think
yeah,
nothing's ever thrown away in our lives,
no.
right?
That's exactly right. So I was practicing as a therapist and happily practicing, and noticed that I was still very interested in people's work lives, to the
Hmm.
point where one day I was talking in a peer supervision group about some work I was doing with a client, where I was helping the client think about getting a promotion. And somebody said, you know, Lynn, that's not really psychotherapy. And I said, well, what is it? And the person said, I don't know, it's some kind of business coaching. And I'd never heard that terminology, but I thought, if this is what I'm doing, I better figure it out. So I found a coaching school that had a strong business coaching component, and went through that school and graduated from that school. And after I graduated from that school, I realized that some of the people that I thought that really needed my help in business coaching were my colleagues, were other therapists. They just seemed so clueless when it came to business. So I started teaching classes to therapists and about the business of therapy as I understood it.
Hmm.
And I wrote a book, and that book got published, and it became a very important book for therapists. And I started teaching all over the world about business for therapists. But I still continue to run my therapy practice. So I was just doing these two things, working as a business coach and then working as a therapist. And one day I was talking with Rich Simon, the editor of the Psychotherapy Networker, who
Yes.
always likes to know what things are new in my work life. And I mentioned that I was seeing some changes in my work as a therapist. And I thought it had to do with the amount of coaching I was doing, that it felt like some of the coaching skills were starting to morph into my psychotherapy, even though it had not been a conscious choice. And then I started to write about that, what that
Yeah.
meant for my work as a therapist, because I'd been trained very eclectically and in a very different way as a therapist. But I just noticed that this change was happening.
Yeah, and in your book, I like your description about how you noticed that you were doing this. And at first, I think it took a while before you sort of gave it credence and said, yes, this is actually a valuable signal, becoming aware of this. And you described almost two different personas, that you kind of had a therapist persona and a
Yes.
coach persona, and you would catch yourself being in therapy and slipping into the coach persona. How would you characterize those two personas?
Well, I felt like the biggest difference for me was, understanding that I'd been trained in psychodynamic psychotherapy and a little bit of cognitive work, but also in a very emotional kind of therapy, paying very deep attention to the kinds of affect regulation that are needed when you're working with patients that have trauma. I usually position myself a step behind the client. So I would not introduce things to a client as a therapist. I would let the client really lead
Mhm.
and set the topic and set the tone. And I would kind of work to go deeper. And as a coach, I took a lot more leadership in with a client. I was directive, I was focused, I was very goal oriented, I was very prospective, looking towards the future more than the past. So I really had two very different ways of working at that point.
Yeah. Does your voice change perhaps in between one mode and the other?
I
Or,
think
or
probably it
physically change?
does. I think
Yeah.
probably it does, because I have noticed over time, when I'm now as a therapist with this coaching edge, I tend to be quite direct and honest in what I say.
Yeah.
And it does get a reaction, I think, at times, that as a therapist, I was a lot softer
Yeah.
and a lot more tending to put questions back onto the client.
Would there
What do
be
you think about that?
yeah,
Let's
would there be more of a interest or tolerance for history in the therapy versus the coaching?
Yes, and I think that we have to. do that as therapists. We really need to look at the history, because so much of what we're seeing in terms of behavioral patterns and reenactment of trauma, it occurs due to history. But when you're just working as a coach, you don't have that mandate to look back in history in the same way. And you don't, most coaches don't have those skills to do that. So that was another way that I was keeping things pretty separate in this coaching practice and this therapy practice. But bringing coaching skills into therapy, for me, it means that you can expand your range as a therapist. You can do more. So you don't lose it. This is an additive process, that this methodology that I'm proposing in therapy with Coaching Edge. You don't lose anything that you've learned as a therapist. I'm just showing you some skills that you can use and bring in when you want some different effects and some different results. And there's skills that coaching has really developed in a very interesting way, in my opinion.
Yeah, in your book, you use the phrase coaching with something extra.
Yes, yeah.
And something extra is?
Something extra, so it was really after a therapy session with a client who was on the edge of losing his job from behaving badly. And by the time we got through that single session, he'd been in therapy before, and he said this was really therapy with something extra. And what he meant is that first it gave him some real tangible, pragmatic steps to take. It made him feel hopeful for the future. I brought in some humor even during this difficult session so that he could, from a slightly lighter perspective, start to put things into an easier way to hold them psychologically and see the path forward. So I think that's what he meant by something extra.
Yeah, yeah. So where do coaching and therapy meet? Where's the overlap, if you will? They're like the Venn diagram, I imagine.
Right.
And counseling, I wonder, what's the difference between therapy and counseling, and counseling and coaching? Because in a way, coaching sounds like counseling in a way. There's some kind of spectrum there.
There can be a lot of overlap. There's some things that are really different about therapy and coaching, and probably the biggest difference, and we talked a little bit about who the therapist was and who the coach was in terms of licensure and training. And the other thing is who your clients are. As therapists, we have clients who are varied and vulnerable. And coaches, for the most part, have clients that are functioning well and that are accessible for the kinds of skills that coaching uses. So those are places where things are separate. Where there's overlap is often in methods, because coaching borrowed from personal growth. And of course, therapy had borrowed a lot from personal growth. And we have Maslow's hierarchy and Virginia Satir and lots of other personal growth specialists that helped us in therapy, and coaching used those. And also coaching, I think, borrowed from organizational development and other methods. So there sometimes, like for example, you can find coaching that sounds very similar to therapy. So we have narrative therapy, and now there's narrative coaching. And we have strategic.
Tell us a little bit about that. How
they've just developed, somebody came along and developed a coaching program called narrative coaching based on narrative therapy. And we have strategic therapy, and now there's strategic coaching. Again, somebody came along and developed a coaching program based on strategic methods. Or it's somatic therapy, and now there's somatic coaching. So if you just looked at method, you'd see a lot of overlap.
Yes. What about the impact of positive psychology? I would think well, actually, I was shocked. I'm remembering now saying that Martin Seligman, who kicked off the thing that labeled positive psychology, started a coaching academy right away, which I was a little shocked, actually, because
and which
it's such
yes, he did. And I actually got certified in that. I took that program.
Yeah, he's such an academic,
Yes.
at least historically, that I was totally shocked to see him so blatantly enter the world of commerce, if you will.
Yes, and I think what it was is that he realized that his delivery of that material could fit within a coaching model. And it actually did fit pretty well within a coaching model. So yes, positive psychology is another example of where there's a lot of crossover.
Yeah. So I guess in the course of therapy, you're making some kind of an internal assessment about whether somebody is, quotes, coachable.
Yes. So, it's very interesting because I thought a lot about who was right for this model.
Yeah.
I felt like it needed to be people who are functioning at least in a better way to be able to accept something that's very directive, right? And to fit within a coaching approach, it needs to be very client-centered. So the clients have to kind of be on board with what you're doing if you're going to use a coaching approach. So I wanted to make sure that clients would prefer this kind of approach. And for that reason, in the book, I offer some ways to identify client suitability in terms of asking questions to see if the clients want a shorter term therapy and one where the therapist is more directive and would voice opinions, and one that might give action steps to take between sessions. I also look at what I would call client challenges, which is, I think that this is a good model if a client is dealing with, mild cognitive distortions or relationship issues or external stressors. I don't think this would be the ideal model for trauma or PTSD or active addiction or dual diagnosis. For that, I think we have some other therapy models that I think are more effective. But I think when you look at, a client who wants this, a client whose diagnosis would lend itself to this, and a client who is functioning well, a client who has capacity for a therapist who is going to be able to make suggestions, to give advice, and that the client can accept that without undue projection or transference. That the client can help with identifying and setting goals and beginning to follow through on those goals. And a client who functions in a safe enough way in the world that you want them to take action, because this is an action-oriented approach. And sometimes, frankly, in psychotherapy, if we have a client who is not acting in a safe way, the last thing you want them to do is to take more action. You want them to develop insight. You want them to develop some self-reflection. You want them to develop some awareness of their body-mind situation so they know what feelings they're having. So this really, I think, presupposes a more functioning client.
Yeah. Those of us who came up in the psychodynamic model would have regarded the request of, doc, give me the pill, give me the med, tell me what to do, as a form of resistance.
Yes.
And they would be trained out of that.
Yes, they would. They would.
But here, interestingly, in some cases, you feel comfortable saying, okay, you're looking for a silver bullet. This could sort of be that if this fits for you.
If this fits for you. So what I'm saying is that in this model, which is what maybe Stephen Johnson, the psychologist who wrote the Symbiotic Core, would have called a postmodern approach to therapy. You have more partnership with your client here, and that you don't see them as a patient, you see them as a client, and you feel like it's okay to work what I might call closer in, where you are keeping a big distance, where you're trying to reduce some of the hierarchy so that they can feel that there's another person in the room who can help them with some of their dilemmas. And we're looking for clients who can accept that and work well within that framework.
Yeah, yeah. You talk about the client-therapist collaboration, and
Yes.
of course, that's very important in therapy, but also you're very explicit about that in your approach to coaching, that there's almost a kind of contract of, okay, here's what I'm going to do, here's what you're going to be responsible for, and there are things you're going to be responsible for starting next time we get together, right?
Yes. Yeah. So this is another thing that's different in this method that I'm proposing, which is that as the therapist, you take responsibility within a session to be able to make that session structured in a way that gets results.
Mm-hmm.
And so it doesn't just happen. It's a structure that you suggest or apply to the session. And that's part of your responsibility as the therapist. And then the client has a responsibility too, to be able to work with you in this way, to be able to agree to set goals for themselves and to move forward. And the great thing about being a therapist, not a coach, but a therapist, is if at any time the client is regressing, or you start to feel like this method isn't working, you have all your other methods that you can immediately go back to. So this is an additive model, not one that's replacing anything that a therapist already knows how to do.
Yeah, yeah, yeah. Part of the appeal to therapists, I think, in the book is you present the possibility of results in every session.
Yes.
And often therapy doesn't feel that way. Like it moves a lot slower. So I would think that's a pretty compelling appeal, to if I put
Yes.
myself in the position of the therapist, boy, that sounds rewarding, that
Yes.
every,
It's really important, I think, for a couple of reasons, and I want to lay out a couple of those reasons. But first, let me help you understand what I mean by results. And
good.
we therapists are not always trained to spot results. But we are often getting a lot of results, but we don't articulate them to the client. So it's not unusual to have a client leave a session, and maybe the client didn't think things went very well or didn't even understand what happened here. But when the therapist goes to write her notes, she thinks it was a very good session, that a lot happened.
Yeah.
And so we therapists have to learn to articulate what we see as results. And here's what I mean by results. I mean, if you see in the moment that a client is demonstrating and developing insight or new cognition, or a client is learning to feel something, is having an affect, or a client is saying something that's different, or demonstrating some kind of strength, or self-control, or self-reflection. These are results that therapy gives and offers. And oftentimes, too often, as I say, we don't know how to stop in the moment and say to a client, that's different what you're doing.
Yes.
I like to see this, or this is what you're coming here to do.
Yeah. It's kind of like in child rearing where they say, catch them being good. In other words, you want to call out those places and bring into awareness
Yes.
when things aren't working.
Yeah. And I feel like this idea of seeing results, it's woven into this method for one important reason to me. And it's something I've been talking about and writing about for a long time, which is that psychotherapy has a very bad track record when it comes to client retention. There have been a lot of studies done that show that we are losing somewhere between 20 to 60% of our clients at the first session.
At the first session?
After the first session, that up to 60% don't return.
Mm-hmm.
And again, this is something that I was never instructed about in any of the methods of therapy that I learned, much less in my master's graduate program was how to retain clients. What I was told is, if you're good, they'll come back. But that's not true, according to these studies and statistics.
Yeah.
And instead, what we're learning is the number one reason why clients don't come back is they don't feel satisfied with what happened in a session. And I feel like it's our job to educate them on what therapy can do and what results are happening session by session. So I give therapists a way to structure a session with a beginning, middle, and end. And the end of a session is 10 or 15 minutes before the session ends to stop and look at, what did we do here today? What do you think happened? What do I think happened? What would I be putting in my notes? What are the takeaways? How do we build on that for the next session? What can you look forward to in the next session? And what can you practice or do between sessions to help you consolidate these gains?
And that approach could be used equally in therapy and in coaching, right?
Yes, this is a coaching approach that I've adapted for therapy.
Yeah.
And this is part of why coaching is so, I feel like, so effective with results, because they use this kind of a structured approach.
Have you had experiences where people don't return after the first session?
Oh, sure. I think lots of therapists have. But
Yeah.
using this approach, much less.
Much less. Okay.
Much less.
Yeah. And so a lot of what's needed is for therapists to develop various skills, such as the one that you just outlined here in
Yes.
structuring a session. And another thing that you underscore a lot is to ask effective questions. So what can you tell us about what is an effective question and a non-effective or ineffective question?
Yes, well, thank you for that. So, in the book, after I show people how to set up a session and how to structure things, I give them 9 coaching skills that I've learned in different places where I've trained as a coach or taught as a coach.
Yeah.
And that I've adapted for therapy, because again, not all coaching works for our vulnerable clientele. And the first skill is asking an effective question. And I thought about the questions that therapists usually ask, and therapists ask questions like, how does that make you feel?
Yeah.
Or who does that remind you of?
Yeah.
Or why do you think that keeps happening? Or maybe a question to buy time or to go deeper. They'll say, can you say more about this?
Yeah.
Right. So these are really common questions in therapy. But in coaching, you are taught, when you train at an accredited coaching school, you are taught to ask a specific kind of question. A question that's open-ended, a question that's direct, and a question that has a chance to create what they would call an aha moment. You're taught to ask these kinds of questions.
So what would be some examples of those kinds of questions?
So here's the kinds of questions I mean. And in the book, I give many, many examples. But one might be, would you rather be right or be loved? What old message could you let go of forever? Who's in control of your life today? What is a win-win solution for everyone involved in this problem you're telling me about? Who do you need to be to make this idea work? And then a question that I love to ask, which is, what new connections are you making in the moment as we talk about this? Again,
those are great questions. Is there some abstract principle that describes the difference there?
Yes, well, in the book, I give people questions that are good questions for insight. And I think questions that are very effective for getting people motivated, and questions that might be very good for helping people to further their idea of possibility, to look out and see what's possible. So what I've done is thought about the questions that I've been using as a therapist with this coaching skill, and watching my caseload and other therapists that I've been training, watching their caseloads with them. And then I compiled a list of questions that therapists can start to familiarize themselves to use.
Well, you've put a lot of thought and work into this, I must say. It's not just something, it's clear to me reading it that it's not something you just tossed off, that
No.
you've put a lot of the kind of research that you're describing, looking carefully at your own notes and the people that you're working with, and giving some very practical advice. The book is just loaded with practical things that people can use. Now, a version of what you're talking about is, you say, in these questions, be strategic with a twist. And what is the twist? What are you getting at there with a twist?
Well, that twist is to use that coaching approach as a strategist. So to think about yourself as a partner, okay, that's going to offer possibility and action, and that you're going to make this very client-centered, very client-centered. So sometimes if I was a therapist trained in strategic therapy, I might be very expert at using paradox as a way to move a client forward.
Sure.
But with a coaching approach, I wouldn't do that, because I want a client to be generating more of their own solutions with me in the moment. So I want to take the veil away from what I'm doing. I don't want it to be mysterious. I don't want it to be out of their sight. I want them to understand what we're doing together and how we're moving forward on finding a strategy. So a lot of times,
you're not going to try to trick them into.
I'm not going to try to trick them.
Yeah.
I'm not going to try to hypnotize them. I'm not going to try to outthink them. I want to be working with them, using this kind of coaching approach, this partnership, action, and possibility, all wrapped in a client-centered approach as much as possible within psychotherapy.
Yeah, yeah. Yeah, and you also advocate humor and lightness, and I guess a certain amount of maybe self-disclosure, or not?
Yes, so I certainly do believe that one of the things that lends itself towards what I would call partnership for therapists with clients is if we flatten the hierarchy. There's a number of ways to do that. And you can diffuse some negative or erotic transference by dealing with it more in a more straightforward way. You can be a model of your services. So instead of telling a client, do what I say, you're telling a client, do what I say and what I do, and you're showing up as an example of whatever it is that you're trying to help a client become. And I believe you can use appropriate self-disclosure. And there have been some interesting studies on the use of self-disclosure that show that it has some very positive effects when it's used carefully and when it's used with intention with clients. Clients cite that they feel more connected to the therapist. It can repair therapeutic alliance when it's broken. It can help a client understand that a therapist is a real person, an authentic person.
Yeah, yeah.
And so I do believe that there's a role for, again, intentional and careful self-disclosure in service of this model. And we have a lot of therapeutic models where this is not a good idea because it's not going to further the model, but it does further this one. It sets you up more as a collaborator with a client.
Yeah. And in some of the other approaches, you're deliberately not so available and transparent, which can do nothing but stimulate projection, right? So you're going
Yes.
to catch a lot of projection and a lot of stuff that
Yes.
is kind of coming from an unconscious place.
Yes. And that's really important if
Mhm.
that's the model that you're doing, where you
Yeah,
want that. And I
right.
certainly was trained in therapies where you did want that,
Yeah, yeah,
but not this. That's not this model.
yeah. You know, this is sort of the model that I use in these interviews and the podcast actually is over time. Uh, People really get to know me because I have disclosed a lot, and and there is an intent behind that, you know, of me wanting to communicate, hey, I'm not perfect and I'm dealing with some of these issues in this way or that way. And so
Yes.
I think it's a good thing to do.
Yeah. So you
Uh,
found it effective too for the
yeah,
purposes of your podcast.
yeah, very much so. I think so. Yeah. And you talk about that, that not only is there this shared collaborative approach, but that the accountability is shared. So accountability for the client means,
Well, this was really interesting, David, and it came from reading a number of studies and articles about some of the problems with cognitive therapy, cognitive behavioral therapy,
mhm,
specific to homework, and how many clients left therapy because they felt bad about the fact that they weren't doing their homework, and they didn't
uh-huh, yes,
and tell the therapist that they weren't doing their homework. And I got really curious about how it worked in coaching, because in coaching, one of the things coaching is pretty good at is getting clients to follow through on their goals. And I realized that one of the ways that coaching does that, now this is separate from therapy, is that coaches don't have a hesitation of partnering with the client, stepping forward to a client, so that when I hired a coach, for example, it wasn't unusual for the coach to email me in between sessions to find out how I was doing, or to call me with a resource that the coach thought that I could use based on whatever goal it was. And that was something that I was not trained to do as a therapist, and felt like it was not appropriate to break
mhm,
that frame as
mhm,
that therapeutic session frame. So I started to wonder, was there a way to help clients who have trouble doing their homework or moving forward on their goals? Now, I'll give you an example. I had a client who he was trying to do some cleaning up of a room in his house. I wrote about this in the book. He had a daughter that was coming to stay. He was divorced, and his daughter was coming to stay, and he wanted to make a room for her in his house, and he needed to clean it up. And this was just a weak point that he had. He was good and strong in a lot of other areas, but not in this. And what we've learned is that you're not really able to transfer what you do, your will, in one area to another area. So it's not like, well, I'm good here when when I need to organize something for work, I do it really well. So I should be able to use those same organizational skills and organize my finances. One thing doesn't always translate to another.
mm,
And will is broken up when they look in the brain to see where the areas are of will. It's in different places in the brain, so it doesn't transfer. And it's like a muscle. So it's like if you are a jogger, you might not necessarily be a swimmer, because the muscles that you need to use for each sport are different. And with this client, he needed to do this quickly. So he didn't have time to develop the musculature in his
yeah,
brain.
yeah,
So instead, I wondered how he could best use me to help him with accountability. And it became something that we discussed in a session. What would be his role with his goal to clean up that room? And what could be my role? And, first he
interesting,
started by wondering, well, does that mean you're going to come over and help me clean this up? And it was
yeah,
like, no, that's not a role I'm willing to take on. But
yeah,
is there anything I could do that I'd be comfortable with that I feel would still respect the ethics and licensure and purpose of therapy that could support you.
Mm.
And this is a different idea for people in therapy. The idea that the therapist wants to support you outside of a session.
Yeah,
And
yeah.
for him, what he said is, it would be nice if I knew that you were thinking about me outside of the session. Could you do that? I could do that. I could think
Yeah.
about him. And then I said, what else? And he said, well, when I come back in, I don't want to have to report back into you whether I did this or not, but I do want you to be curious about it. So let's discuss how we'll talk about it at the next session. So I don't have to set myself up for failure, but I know that you're carrying the through line of therapy and you're going to ask me something about it in a way that feels respectful. So again, that was the shared accountability,
Yeah.
ways that I could support him that felt appropriate as a therapist, that borrowed from coaching and would help this person feel like he had accountability with me. Not that I was a parent, not that I was a teacher expecting homework. I'm his therapist.
Yeah.
But still feel like it mattered.
So what did you, I have to get to the end of the story. What did you come up with as the way that you could actually say something that didn't feel like a parent or a teacher, et cetera,
So
or a nag?
what we agreed on is that I would ask him how it went and what did he learn.
Mm-hmm.
And that he felt like that would not be like a parent or like a teacher, because it's not that I was caring, did you do it or not? It's more, I'm curious about how it's affecting you and what you might be learning about yourself.
Well, getting back to CBT and people not doing their homework, what has been the secret in coaching to structure homework in such a way that people want to do it or do it?
I think it's this shared accountability. I think it's the idea that, there's this metaphor about the difference between therapy and coaching, this bicycle metaphor, that if you're learning to ride a bike and there's a therapist present and a coach present to help you, the therapist would stand off to the side and say, oh, let me observe how you are balancing on that bike and how you're pedaling and where did you learn to put your feet like that and how are you feeling and what are you thinking? And the coach would get on the back of this bike, the back of the seat right behind you and say, where do you want to go today?
I love that.
That's a really different role, different role. So coaches, because they're not therapists and they don't need to work in the same way with the ethics and the licensure and the transference that we use as therapists, they can get on the back of the bike. They can work that closely. They can say, call me every day, and tell me how you're doing on this. They can say, what else can I provide you with? So they can do a lot more to help someone be successful in the homework.
Yeah. Yeah. Speaking of homework, I want to mention that at the end of your book, you've got an addendum and worksheets that cover all sorts of things that a person would want to know in order to be an effective coach. Tell us a bit about that and foreshadow for us a little bit of what people will find there.
Yeah, so what I've done, thank you. So what I've done is I've given people these 9 skills. And there's the skill of asking effective questions and to be a strategist with a twist and to add in humor and lightness, which is actually a coaching skill you must demonstrate to be accredited, to be certified as a coach. You have to demonstrate your ability to use humor and lightness. There's 3 skills for action: calling a client into action, how you get a client into readiness. This skill of adding shared accountability and what I call delivering a coaching edge. And that's the skill of really confronting for the sake of the client, to be able to be very direct in your language. And then there's 3 skills of possibility: how to help a client align with core values, to find metaphors that really matter, and to design a plan for life. And when I outlined these skills, there are exercises for therapists, and they're things that I wanted therapists to know to do. So the publisher asked if I would bring all of the salient points of these skills in one place, and those are the worksheets at the end. So rather than having to thumb back through the chapter, you can just see the most important points right there.
Yeah, that sounds great. In doing the book, were there any especially challenging places for you that, presented more of a challenge or difficulty than you expected when you first launched into with this great idea?
Well, this is my 6th book for this publisher, and this was the most difficult book to write. It was very difficult. First of all, I had to rely so much on so many aspects of my own life. The coaching I'd been through, the coach training I'd taken, the clients I'd worked with, my caseload, finding my own metaphors and anecdotes and making it an interesting book. And then I also tried very hard to make the style of the book reflect the content. So it's kind of a coach-like style in reading it, that it was pragmatic and lively. And as a result, it took a lot to write this book. And unlike my other books, I also used self-disclosure in this book and wrote at length about some of my own growth and development to illustrate some of these points. So that one of the things I talked about, for example, in the chapter of calling a client into action, was that skill of how you get a client into readiness came from my own experience of hiring a coach, a young man who was a personal trainer and a coach, a basketball coach, to work with me after breast cancer surgery.
Wow. Yeah.
And I watched, he was helping me get an exercise program together for which I had been tremendously resistant, even though my surgeon had said, you need to be exercising your upper body and building muscle again. And I knew it was a really good idea. I just didn't want to. And I didn't want to, and I didn't want to. And finally it was like, okay, come on, Lynn, you need to get some help here. And this young man began to work with me as a sports coach, which he was. And it was so interesting to watch the way he got me into action. And he worked with kind of a child part of me. I once said to him, you're teaching me just the way you would teach an 8-year-old, right? And he said, a 6-year-old.
That's great.
I wasn't even an 8. I wasn't even 8 at that point. He was having to work with my 6-year-old self.
Yeah, yeah.
But remembering that and then looking at what happened, and his method with me was that he started with very, very small steps. So he didn't ask me to be able to do the kinds of exercises. He trained me to be a basketball player, and I'd never held a basketball, but he knew that would be good for my upper body. And so he started training me at the soles of my feet on up. And he also made it a game. It was just a game. And when I would get scared or when I would resist, he'd make it playful again. So he had I felt like just, some really wonderful ways of helping me develop. He also tied everything we did to this bigger vision, even that when he was teaching me to kind of strengthen my ankles, it was because one day I was going to play basketball with him. This was the vision.
Wow.
Which used to make me laugh to no end. But you know what? I did. I ended up becoming a basketball player. I joined an women over 50 league.
Really?
These leagues are all around the country. I went to Not Too Late for basketball camp in Portland, Maine, which was for women over 50 years old. He and I developed a clinic it was so effective what he did for me. I got so strong that we developed a clinic for breast cancer survivors. And so writing about this in the book was like very touching to me.
Yeah. Oh,
And
yeah.
then what I did is I used this skill in the book to show you how to call a client into action. And just like he did for me, but translating it for psychotherapy, that you lower the bar for a client. You kind of assess their readiness. You look at very small steps. You do some cheerleading with the client so they feel ready to take those steps. You make the action steps relevant to something that they want, like he did for me. I'm going to make you a basketball player. And then you use an experimental frame so that, just like with the homework, it's not a win or lose. It's you lighten up, you stay curious as a therapist, and you debrief things in between sessions. You ask things like I did with this other client. What did you learn? Okay. What did you learn about yourself? What do you need to do more of next time? What will you do less of? How are you stronger for even trying this? Okay. So you help a client ask themselves the questions that help people go forward and persist and stay in action. And I learned that from this sports coach and then modified it for our purposes as therapists.
I'm so glad you shared that story here. And it illustrates so many of the things that you're talking about. And I think this might be a good place for us to wrap it up. What do you think?
I think that's fine. So
Okay.
It was a delight to talk to you. Thank you for your great questions and all your interest in this.
Well, Lynn Grodzki, I want to thank you for being my guest today on Shrink Wrap Radio.